everyone, Dr. Vicky here. Welcome to Sihat Beyond the Clinic. Today we have got a very special topic. It's understanding rare types of breast cancer and pink misconceptions. So we've got a subject matter expertise, Miss Sumitra Selvaraj. She represents the Breast Cancer Welfare Association as the General Manager, and of course we have our own Dr. Amey.
Thank you very much, Vicky. Welcome, Ms. Sumitra.
Thank you.
As always, we discuss important topics among the healthcare field. And today we have a very special guest from CWA, Ms. Sumitra, who will be understanding rare breast cancers and breaking pink misconceptions. Vicky, over to you.
So I think when we speak about rare types of breast cancer, as a clinician, I'm looking at things like HER2, positive breast cancer, inflammatory breast diseases, or Paget's disease, male breast cancer, malignant type of breast cancer. These are some of the examples of breast cancers that are rarer and often less discussed.
Triple negative
breast cancer. So all of these are often less discussed compared to other types of breast cancer out there. Yeah, I mean, so these cancers can grow very aggressively, and they can also affect younger women. That's the concern here, because younger women, of course, we know the clinical practice guidelines. So the guidelines say you start screening at the age of 30.
It should be, I think, if I'm not mistaken, it's been down revised to 20.
20. So now the latest guideline, I stand corrected, is starting at 20 years old for a clinical breast examination and mammogram at the age of 40.
Correct.
Unless they are high risk or symptomatic. Yeah, then it warrants an earlier mammogram plus an ultrasound as required, ultrasound of the breast. Yeah. So what makes it more challenging is that breast cancers are not usually the typical lump. It doesn't present as just something palpable that is, protruding as a lump. So what else can be signs of breast cancer, Sumi?
We can be looking at the thickening of skin on your breast. We can be looking at redness or rashes that doesn't really go away with topical application of some medication. It could be even really unique symptoms like a dimple on your breast. When we teach breast self-examination, we always tell women that, dimples on your cheeks are really nice, but dimples on your breast are something to really look out for. So, we tell people that don't go down the hard and fast rule that it must be a lump. Yes.
Absolutely. Dr. Amey, do you think there are misconceptions about breast cancer?
Yeah, there are lots of misconceptions. That's why awareness is important. So there are a lot of lesser knowledge among Malaysian women, and they can be, if they don't feel pain, it might not become a problem. Right. So they don't seek treatment elsewhere if they don't feel any complaints that they have. Another myth is they don't have family history.
Yeah, this is probably the one that we see most of. Whenever I stand up in front of an audience of women and I give them a talk and I say to them that really you're looking at maybe 85% of 90% of cases, not having a genetic link, you can almost hear the gasp from the audience. They just don't believe it because, I don't know where this notion has come from, but they just truly believe that I don't have to think about breast cancer or I don't have to worry about breast cancer because it hasn't happened in my family. And when you talk to them about the genetic link, you can almost see that they don't quite believe you because the narrative has been so strong.
Absolutely. And in Malaysia, cultural misconceptions also play a heavy role, especially in terms of breast cancer screening, because breast cancer screening requires the lady to expose herself to a healthcare professional. So what are some of the types of misconceptions that you've come across, Sumitra? Can you share with us?
I think another popular misconception is the fact that breast cancer is an older woman's disease. And when I say older women, I think, very much the perception is, I only need to worry about it if I'm in my 70s or 80s. And yet, as you mentioned earlier, there are many types of breast cancer that occur to younger women. Triple negative breast cancer in particular strikes women at the peak of their lives, usually in their 40s. But also this idea that these days, we are just seeing breast cancer being reported at a younger and younger age.
Absolutely. The statistics is speaking for itself based on the latest National Cancer Screening Registry report as well. But we do have multiple screening programs going on nationwide.
Yes.
It's done both in the government sector as well as the private sector. And we have got CSOs that's advocating breast cancer screening. Yet, we still have women that's being detected. I think more than 50% is still being detected beyond the stages of, almost 50%, beyond the stages of 3 and 4.
I would hazard to say, although it's not an official statistic, I would hazard to say it's far beyond that.
Far beyond that.
You know,
Why?
I think if I had to pin it down to one thing, it would be, let's specifically look at the idea of diagnostics and screening. The amount of myth and taboo and stigma that exists around mammography, I think is something we need to address. For some reason, women, even educated women who are exposed, have this idea that mammograms can cause my breast cancer to spread. Mammograms will cause breast cancer, even though, you know, studies have been done to prove that the mammogram is the gold standard when it comes to breast cancer diagnostics. We know that the reward outweighs the risk.
Correct. And we also know that there are some ladies out there who has had the concerns of mammogram causing radiation.
Yes.
Inducing breast cancer. This was...
Yes. And to that, I say that you're absolutely right. A mammogram is an X-ray. It does emit radiation, but it's no more radiation than you would kind of face if you were on a long-distance flight from KL to London.
Correct. Or driving a car.
Yes, I know. And you're willing to expose yourself to those experiences because they are pleasurable, because, you know, you like the outcome of that. But here's a life-saving diagnostic that could potentially save your life.
We just sit there uninformed about these kind of things because all we hear is, oh, go for testing, but we never hear about whether it's safe.
Okay, so to kind of address your question and to tie it in with something Vicky mentioned earlier on, so something that we believe at the Breast Cancer Welfare Association Malaysia is breast health literacy. Health literacy starts young. If you don't teach 18-year-old girls about the need for breast health education, they will not turn into 20-year-olds who will submit to a clinical breast examination by a nurse or a doctor. And these 20-year-olds will never become 30-year-olds who submit to an ultrasound. And those 30-year-olds will never become 40-year-olds who will agree to a mammogram. We have to take it all the way back down to education of our girls and our young women.
Absolutely. But Dr. Ame, my concern here is if it's a science-based misconception, then you address it scientifically. You educate the facts out. But how about if it's misconceptions related to probably hesitancy from the partner? The husband not allowing the wife to go for screening, things of that sort. How do you suggest we address those type of concerns?
I like the fact that you've pushed the question to the only man here.
Absolutely.
I think you should look at it in a very holistic manner. You're not treating the person only because they may come from a big family where the lady provides for the family and the lady brings a lot of contributions to the family. So you should empower women as well and the family to allow the person to go and get tested. And this is done by including the man as well for follow-up, encouraging to come as well, and encouraging, like you said, since they were young, from before they were pregnant, include the father, the whole family get tested.
When we teach breast self-examination at BCWA community outreach events, we teach it to people of all genders.
Holistically.
And because we understand that, you know, when we talk about recognizing and feeling what a lump feels like under your fingers, even men need to know that. Because if your partner comes to you and says, do you feel what I'm feeling? You do not want to be the sort of man who dismisses her and says,
Yeah.
it's probably nothing.
Yeah.
So the knowledge
Yeah.
has to be across the board.
Yeah. So breast cancer awareness should not be targeted only towards younger women or adolescent girls. It should be done holistically to everybody in the community, because everyone is dealing with a lady in their particular family member or their close group of friends who might have the symptoms of breast cancer undetected. But that one person having that awareness and giving them that message at that right point of time directs them towards early treatment. Okay.
We see this sometimes when we do community outreach in a corporate setting. And very often the organizer will come back to us and say, yeah, you know, we've managed to gather all of the women for the talk. And I always say, why just the women? Why
Yeah.
not the men? Then the answer always is because the women will feel shy with the men around. And that is the problem.
Yeah.
If you cannot have a neutral, safe conversation about health in a very, very safe surrounding, then
Yeah.
that's the uphill battle that we have.
That stigmatization at the roots itself in our community. Ame, Dr. Ame, from your perspective, breast cancer is not a diagnosis that is end of life. Yeah. So many women continue to live healthy, meaningful, productive life even after diagnosis. Some of them being treated, some of them get well, some of them don't. So survivorship is real. Survivorship is crucial. So how do you think peer support groups like BCWA plays a role in this survivorship advocacy?
I think your question is very interesting because when we look at breast cancer among women, and we also, may I say, sexualize breasts as well. And we also know that male women are affected by breast cancer as well. So
Yeah.
the support group is important to break that barrier of seeing breast as that object. So it should be spoken about openly. People are free to seek help, seek advice, and also the caregivers also, it's easier for them to give advice to them. So in terms of support groups such as BCWA, they play a very important role in breaking that barriers, going out there and supporting the people affected can be treated already. And also breaking the stigma towards
Yeah.
the community that
Yeah.
it's not something to be objectified. It's not something to feel ashamed of seeking help and talking about it. So the work you're doing is crucial.
The work our fantastic members are doing, you know, adding on to your point, very often when we go to hospitals, we've got a small team of trained peer support volunteers who do bedside visits in hospitals to speak to newly diagnosed patients. Very often when our peer support volunteers go in, the first piece of feedback that we get from that patient in the bed is, I didn't realize that a breast cancer patient could be so healthy. Because they're not thinking long term. They're thinking about themselves sitting in that hospital bed, thinking about how awful they feel. And then in walks this warm, cheerful, engaging woman saying, I too had breast cancer, and, you know, let's get through this together. I think that's what we offer. We offer hope,
Yeah.
we offer resilience,
Absolutely.
and we offer tomorrows, which is always important.
Absolutely. I think BCW is doing an excellent job because on one side you're having educational programs. On the other side you're having screening programs. The other side you're having advocacy, and you have heavy survivorship support.
Yes.
So as it's a holistic approach towards breast cancer. Dr. Ami, what do you think Malaysia should do next in terms of breast cancer?
We're talking about offering tomorrows.
Yes.
So what you're doing is a model for what Malaysia should do, like what you said, offering resilience, offering awareness, offering tomorrows for people to be aware of breast cancer and not treating them as something demeaning, an object, or something to put them down. So what you're doing, offering tomorrows, spot on.
We could also do with, I'm going to say it, more political will in creating a really robust framework for breast cancer quality of care when it comes to breast cancer. We need more access to screening. We need faster turnaround times. We need more beds. We need more consultants. We need more access in rural areas. Right? And we need to scale all of this up. And also, because of where we come from, I believe that there is space in this ecosystem to have peer support volunteers nationwide. Why shouldn't the smallest clinic, Kesihatan, and the smallest regional rural hospitals have these women who are able to speak to breast cancer patients? I mean, what is the statistic at the moment? 9 women at the moment in Malaysia die every day from breast cancer. It is a problem, and it's a problem that we can address.
Resolve. It's a huge issue. There's definitely gaps in the healthcare system at the moment. It's not perfect. It's not too bad either. We're somewhere in between. We're improving. There is a strategic roadmap towards breast cancer that has been released recently. There's a lot of new inputs, new changes in guidelines that's there. But I think it's a matter of implementation now. This framework has to come to the ground and it has to be rolled out, implemented nationwide. So this is not a hospital issue. This is a societal issue.
Absolutely.
Everybody needs to get involved. So closing reflections from you, Ms. Shumi.
Wow, there's so much to say. I want survivors of breast cancer to feel that they have a role to play in what comes next in the quality of care for breast cancer patients in Malaysia. Survivors have walked the path. They've walked the journey. They contain the most important bits of information, the most valuable bits of information on how we can truly make survivorship count. In the current age of science and technological advancements, breast cancer survivors are living longer and longer. We need to create space for them.
Absolutely. Dr. Ame, your closing reflections.
I think that would reflect on us as doctors. That we should understand the cause, support it by spreading awareness to the community. Because the role that we play is we can influence good things. So take on this cause.
I think we have all, for me, my closing reflection is I was from a convent. And it's a fully girls' school, obviously. So nobody speaks about breast cancer. This was, I cannot reveal my age, but this is about, we're speaking about 20 to 25 years back when I was in primary school. Nobody speaks about breast cancer. We have come a long way since then. Then it was a taboo. Now we're actually speaking about breast cancer openly in the schools, which is a good thing, but it's still being taken as a taboo, a stigma, and something to be joked about. Like you said, you rightfully put the word sexualized. So I think we have to move out of that in order for it to be a norm, for everyone to understand and move forward. So thank you so much for your attention. Thank you so much for your time. Stay tuned. If you have any questions related to BCWA, feel free to drop your comments in the comment section, and Miss Sumi or either one of us would address it personally to you. Thank you.
Thank you.